Good afternoon, everybody. I'm Nikhil Godbole. I'm a third-year med student at Tulane University School of Medicine. And what I have here to present to y'all is a social media analysis of patient and caregiver perceptions of adenoidectomy surgery. And so basically, with the increasing prevalence of the use of social media, more Americans, particularly the younger demographic, gravitating towards it. Um, Social media can be a representative source of information of, kind of the more candid thoughts of what the broader population may be thinking. And so, given the increasing popularity of outlets such as Twitter and Instagram, we kind of decided to use this method to kind of assess opinions and patient satisfaction towards adenoidectomy surgery. And the reason we chose adenoidectomy is because it's a very commonly performed procedure in kids, with over 500,000 procedures being performed annually. And it's also been shown that the available information has largely been viewed as inadequate to sufficiently educate patients as well as caregivers. And many studies have shown that with the increasing discordance between patients' expectations and the care that they actually receive, that patients take to social media to kind of satisfy some of the needs that may not be being met, such as, educational materials, accessing shared experiences and testimonials, as well as, just seeking emotional support. And so we essentially screened using the search terms #adenoidectomy and #adenoidectomy recovery to identify posts related to adenoid surgery. So the initial search revealed about 12,000 posts, and there were inclusion and exclusion criteria. We narrowed it down to about 394 posts that were specifically related, that were public, and that met the demographic criteria, that were either made by patients or made by caregivers. Um, and we were looking for posts within the pre and post-operative period, and to kind of identify key demographic trends as well as key thematic trends. So we assessed the frequency of the major themes. We used chi-square tests and Fisher's exact test to determine significant themes as well as significant demographic trends. So this is our coding tree. So some of it is actually chopped off, unfortunately. So this is a part of the coding tree. And it's basically once we compiled our posts, we screened them to identify common themes, came up with criteria, and just started sorting posts based on these themes. So these are kind of the demographic trends that we identified. And the key criteria we were looking for is we were trying to identify if a post was made by a patient, made by a caregiver, and identify the gender as well as identify whether the post was made pre or post-operatively. And so what we found was the majority of individuals that were posting were caregivers. The most of the posts were made by females, and the majority of posts were made in the post-operative period. And we also found that caregivers were more likely to post preoperatively, whereas patients were more likely to post in the postoperative period. And so as far as significant themes, what we found was that regardless of whether it was a patient or a caregiver posting, the most common theme was themes of recovery and rehabilitation. So people were concerned about, how they were recovering from surgery, how they were progressing. But there were also key differences that we identified between patients and caregivers. Patients were more likely to post about themes of mental health as well as pain, and they also had significant concerns for appearance when recovering from treatment. And we found that caregivers were more likely to overall have like a positive tone in their posts, and were more likely to focus on spreading information, spreading knowledge, as well as providing emotional support. but they had less of a concern for appearance, mental health, and pain than patient posted. And then once we broke it down by gender, we found that female caregivers were more likely to post about the mental health of the poster, as well as post more about emotional support for the patient, as well as more about their emotional status, such as the fear that the patient was experiencing, whereas male caregivers were more likely to post about scientific explanations and spreading positivity. Based on these findings, there was definitely an overall negative perception of adenoid surgery in social media, particularly because of themes such as pain and scarring. And this is largely corroborated by the literature, which kind of correlates pain as like the major prognostic indicator of how a patient perceives a procedure, as well as how a patient perceives the provider which is performing the procedure. And so, themes of scarring, pain, mental health were significant in the patient population. Um, and some of the more interesting findings were also kind of how gender may play a role in how caregivers utilize social media. Um, and there may be a correlation between that. The literature shows similar changes in how genders use social media, particularly in like the physician population, in terms of how physicians may use social media in different ways, whether it's to as a form of emotional support, or whether it's as a form of spreading knowledge, kind of similar to what was found here. Um, and it kind of, helps inform the discussion of how counseling may be able to be more patient-focused based on the needs that may arise in the pre and post-operative period. Like, what we found here was that caregiver concerns are kind of at the forefront in the preoperative period. Um, so it may be beneficial to cater towards caregivers' needs during this time. Use social media in a way that helps ease their anxiety and concern. Um, and then in the post-operative period, focus a little more on what the patient's primary concerns might be. Um, and another important relationship was kind of like the overall tone of how social media posts are portray a surgery might be heavily procedure dependent. Um, the study found a predominantly negative perception surrounding adenoid surgery, but other procedures such as anterior cervical discectomy and fusion were actually found to have a predominantly positive perception in social media. Whereas other procedures such as surgeries correcting male infertility also had a predominantly negative perception. So there may be a relationship there as well. And so as far as relevance, like I touched on earlier, time appropriate points of focus for counseling within each stage of the operative period may be something that can be more effectively implemented through studies such as this. Um, and for example, there have been studies that were shown to like using storybooks to kind of demystify the operating room and kind of demystify the procedure a little bit. And these were significantly found when compared to controls to lower anxiety levels in kids before surgery. So implementing things such as that, as well as counseling patients and caregivers, making sure that they have the appropriate access to educational tools, promoting awareness of the condition, and providers could also use social media to create informational materials, like take videos of the operating room, provide information about what instruments will be used, as well as provide patient testimonials about their experiences, and so they can have access more easily to shared experiences. Um, and yeah. And so in conclusion, the goal was just to kind of inform, kind of take social media as like a way to kind of have a more unfiltered view of what patients may be thinking. Traditionally, patient feedback studies have been prone to certain biases, such as favorability bias, and as well as researcher bias, and the more traditional biases that come with observational studies. And so, we thought this would be kind of a way to help minimize some of that, although social media comes with its own set of biases. Um, and identified some key gender trends as well as key demographic trends, which may help to inform and further homogenize the patient-provider relationship, as well as inform conversation during this time. And that's basically all I have. Thank you guys for your attention. You guys have any questions? Um, yeah, thanks for the question. As far as future directions for this, we didn't actually have adequate sample size to do like a more thorough like gender analysis between the two groups. So as far as future directions, we'd probably like to go more into like different demographic variables, probably go more into gender relationships and how those might play a role. Um, and as well as expand this to like analysis towards other forms of surgeries, which we don't understand as much about. Thank you.